Good morning. Welcome to the Ohio Commission on Minority Health's Certified Pathways Community Hub Application Technical Assistance session. Today's pre-recorded session will be provided so that you are able to start and stop this presentation at your convenience. Given that the presentation is pre-recorded, we will not read each individual slide in their entirety. Please do take the time, and we recommend that you take the time to read the entire slide so that you have the best understanding of the Community Hub application. And with that, we will begin. With regard to the Commission's background, in February of 1986, the Governor's Task Force on Black and Minority Health was appointed to determine why there was a health disparity between the minority and non-minority populations in Ohio. In 1987, there was a final report where there were 12 recommendations, one of which was the establishment of the Commission. To this end, through the amended substitute House Bill 171, the Commission opened for business on July 1st, 1987. Since that time, we have funded projects which are innovative, culturally sensitive, and specific in their approach toward the reduction of the incidence and severity of diseases or conditions, which are responsible for the excess morbidity and mortality in minority populations. Health promotion and disease prevention activities constitute the primary focus of projects that the Commission funds. Further to substitute House Bill 171, the specific groups which the Commission is charged to serve are African Americans, Hispanic Americans, Native Americans, and Asian Americans and Pacific Islanders. While all of our programs target those specific populations, all services are free and open to the public, and no one is declined services with regard to their race and ethnicity. Specifically for the Hub funding background, in 2000, the Commission provided seed funding to support the Community Health Access Project, who actually developed the Community Pathways Hub model. From that point, the Commission funded the Hub model through our demonstration grant funding program. However, through amended substitute House Bill 64 in fiscal year 2016-2017, the Commission initiated a funding request specifically for $4.1 million to expand and replicate the Certified Pathways Community Hub model, which had demonstrated success in reducing infant mortality in minority populations. However, the Commission was approved for $2 million in funding to expand and replicate this model. The Commission is now in our second year of our second biennium of the Certified Pathways Community Hub funding. Further to this funding, for the current Hub RFP, we have been provided additional funding. This additional funding and the funding that we presently have was allocated to further expand the Certified Pathways Community Hub model. For specific target areas, please consult the current RFP. With regard to definitions that you will see in the RFP, existing hubs must have been in operation at full capacity for no less than 3 years. Existing hubs must also be certified. For other definitions with regard to who this hub is able to be awarded, please consult the present RFP. With regard to funding level, please consult the RFP for the current infant mortality grant funding. Only one application will be accepted per agency. The funding period for the grant is January 1 through December 31st of the coming year. As with all of our grants, funding will always be contingent on the approval of the state budget, and this year our budget was approved and expanded. Given that grants will be effective in January of each year, an immediate startup will be required. Thus, recruitment for your program, if funded, should begin once the acknowledgement of terms is countersigned and returned to you and your agency's budget is approved. This would allow the immediate hiring of staff in the first month and the immediate implementation of program activities no later than the second month of the first quarter of funding. This is a performance-based grant. While the second year is non-competitive, it is contingent upon you achieving your goals in the first year. And we reserve the right to terminate a grant prior to the second funding cycle if the project does not perform according to their stated measurable outcomes. For the second year, program activities must continue without gaps in services by providing programs, again, beginning in January through December of that next year. The following types of programming the Commission will not consider for funding: those which seek funding to support residential services, where treatment constitutes the primary service; those which request funds for the purpose of construction or renovation, to conduct research in or independent programs of service delivery; those which are legislatively mandated and funded by other public dollars; those exclusively designed to conduct conferences or workshops; and those which operate to seek regional, hybrid, nested, or lookalike hubs. Please consult the current RFP for the submission deadline. The submission deadline listed in the RFP has no exceptions. The RFP must be submitted in our Minority Health Grants Management System. Where you have questions about technical assistance for the system or the RFP, please submit those questions to minhealth@mih.ohio.gov as you see here on your screen. Please know that the submission of your technical assistance questions or questions about the RFP, if they remain unanswered, that does not change the due date of your application. Please do begin your application in enough time to allow 1 to 2 business days for response to your technical assistance question about the system or your RFP question. Furthermore, any application or supporting documentation submitted after the date that's included in the RFP will be returned without review, meaning that in the system, once it's submitted, we will not be reviewing the application if it is submitted after the date and time. Hand-delivered, faxed, mailed, and emailed applications or portions of applications will not be accepted or reviewed. There is no exception to this rule. Applicants must allot sufficient time to submit your application in the system, as I mentioned earlier, because given that this is a new system, we strongly advise that you allow enough time for any question you may have to be both submitted and responded. With regard to funding eligibility, priority will be given to grants who develop services in accordance with the mission of the Commission. However, to receive consideration for funding for this particular application, you must demonstrate that at least 20% of your project funds are received from sources other than the Commission. You must be a public or a private organization with a valid and active 501c3 at the time of your application submission. Local health departments or regional health districts, you are exempted from this requirement. You are eligible to submit an application. You must develop and establish a management board for the administration of the grant that's composed of the proportionate representation of the population you intend to serve. You must provide services in close proximity to minority communities or include minority communities that are in their stated service area. You must meet all licensure and certification requirements, answer all the questions on the administrative compliance form, and comply with all current and applicable laws, registration rules, administrative guidelines of the Commission. The following are ineligible for funding consideration: individuals, organizations that do not have a valid or active 501c3 designation at the time of application submission. Again, health departments, you are exempted from this particular requirement. National organizations, however, local affiliates of a national organization may be eligible if they meet the definition of community-based health group. For example, the American Heart Association is a national organization. However, there are local affiliates of each of the American Heart Association. The local affiliate, or like the Columbus office of the American Heart Association or the Cleveland office of the American Heart Association, would be eligible for a grant from the Commission because they are an affiliate of a national organization. That's just an example of how one would consider itself a community-based health group. Further to funding ineligibility, organizations that are applying for the sole purpose of requiring funds to supplement existing programs without any plan for enlarging their scope of work are not eligible. Organizations that are in the process of creating or starting a community-based health group just for the purpose of applying for this grant are also not eligible. Furthermore, ineligible entities include regional, hybrid, or nested or look-alike hubs. And by nested, we mean there should be no nested services from one hub to another and no nested billing between one hub to another. Each hub is expected to stand on its own and operate accordingly. The following is a list of critical elements for the hub application. These are grant participation requirements. While I will not read each of the bulleted items, it is important that you read through each of these critical elements to have an understanding of what specifically will be required of your agency should you decide to submit a funding application for the current hub. First, you must have a fully executed AOT. That means you have received your AOT, signed it, responded to all the program and fiscal special conditions, and loaded them back up into the MHGM system. You have to respond to your AOT within 60 days of the grant notice, or you risk forfeiture of your grant. You will need to attend a mandatory grant startup orientation. All agencies must also understand that any mileage that is accrued during this particular funding cycle is only allowable up to the state of Ohio rate of 52 cents per mile. All funded agencies must also enter their data into the care coordination system. Further details are located here. All agencies must provide the Commission's program manager and the Research Evaluation Enhancement Program with access to their data. And all hubs must track, monitor, and report their client services and pathways and provide updates in real time in the CCS data system. Further critical elements are listed here. Please do take the time to read them. If you should have any questions, again, submit them in writing to minhealth@mih.ohio.gov. Additional critical elements. Additional critical elements. And again, critical elements are grant participation requirements. Additional grant participation requirements. And again, you can stop and start this particular presentation as often as you like. Please do take notes that not just to the participation requirements, but the detail within them with regards to the number that must be served and any percentages that must be served. And our last slide of critical elements. As previously mentioned, the Commission now has a Minority Health Grants Management System. You'll see this acronym MHGM throughout the remainder of our presentation. We do offer technical assistance, which you are sitting on today. You are able to access this pre-recorded session by visiting our website, which is listed for you here. Further instructions on how to navigate our website to obtain this pre-recorded session are indicated on this particular slide. For application guidance, responses to this RFP application should be prepared following the guidance in the RFP. Proposals that do not provide all the requested information or don't meet all the requirements specified in the RFP will be determined incomplete and will be disqualified, meaning they will not be scored. To help, the Commission has provided an applicant user guide, which can also be accessed at the website indicated on your screen. Directions on how to navigate to that particular applicant user guide are also located on this particular screen. As we go through the application for submitting the hub application, there are several application sections that you'll need to navigate for completed submission. The face sheet, organization information, project abstract, proposal narrative, staff description, which also enables you to do the board description, method of implementation, the project action plan. For some of you, those were formerly the standardized goals and objectives, the line item budget, project documentation, signatures, and grant submission. So with that, if you will allow me to navigate to the OCMH portal. Once you have registered yourself and your agency, you will be emailed your username and password. Excuse me, couldn't type and talk at the same time. You'll be provided with the link, which is already on our website, for you to navigate to the OCMH portal to submit your application. Uh-oh, we have an error. Let me go back to see what I did wrong here. And if ever that happens to you, go back, please, and just re-enter your information. Let's try that again. I think I didn't put my password in the correct way. It may take a moment for it to load. All right, now we are in. And again, if you ever get a yellow page or an error like that, close the particular website window, reopen, and log back in as I did. It happens. So from here on my dashboard, I'm going to navigate down to the application so I can show you specifically what the Hub application looks like. So please forgive the delay in the system loading. It'll just take a moment. And depending upon how busy your agency is, this page may take a little longer to load, or sometimes it comes right open, but it depends on how many people are accessing at one time. Okay, so then I will go down to show my applications. I will click on the name of my organization, which I have already registered. I'll click on my address. Then I will click on load applications. And here you have listed, if you've started your application, where you are able to edit your application. So I'm going to click on edit. Since I've preloaded this sample application, you'll see several of my pages are already preloaded. Yours will be blank so that you're able to enter this particular information. So on your face sheet, this is just your organization information. So you will have, if you'll notice, you'll have a timer up here in the upper right-hand corner. This will help you understand that you've got a limited amount of time on each page. However, as long as you move that cursor and keep entering information on your page, that timer will refresh. If you leave your page dormant, you will be closed out of the system and asked to log back in. Once you log back in, you'll be directed on how to save the information that has been entered on your page up until your screen became inactive. If you do not follow those prompts, you will lose the data. If you follow the prompts, you will save your data. The best way to save your data is to complete the entering the data on a given page and then hitting next. So again, this particular face sheet is the just your organization information, so you'll fill them in accordingly. For which type of grant, who are you applying to for this grant? You are, of course, applying to us. We will be the only entity in the drop-down menu. You will put in your appropriate fiscal year, and there are a number of fiscal years listed. You'll put in which one you are applying. And then your grant type, you'll click on the drop-down menu. I was applying for the Hub application. Project area, there is only one for the Hub, so you'll be able to select Hub. Your application number will automatically generate. You will not be able to put anything into this box. It will be populated for you. The requested amount, you'll put in whatever the amount is of the grant on the current application. I put in a random number. With regard to how many years you've been serving, you'll answer that question accordingly. Then you'll enter the information for your program title. If you'll notice, I put in the word test. You'll be able to see how many characters are available to you in each text box. That way, we want you to be aware that not just is there limited space, but you have the opportunity to answer a particular question in a Word document and either cut it and paste it into this box. And again, it's character, not words, but characters. Or you're able to simply type into the box and then be made aware of how many characters you have remaining with the text, the character count right here in the lower left corner of each text box. Then you proceed to answer each of the questions here for executive director of your agency, the project director, which is the day-to-day person on the project, and your fiscal officer, who will be handling all of your fiscal information. The project lead will automatically be populated for you, and that's the primary contact of who, once funded, you will interact with the commission. And then you hit next. That saves the information on your page. Once the information has been entered and you click next, your organization information will populate this page. And as you can see on this page, your congressional district is pre-populated for you. If you were awarded funding, those are the particular individuals that we will send your notice of award, and then we will send your notice of award to yourselves as well. So for this page, you simply click next. I should also note for this page, you can click over here on this section when your application has been started and there is typing in each column. You're able to click anywhere on the left-hand menu. If you have not completed anything thus far, your application menu will stop at the page where you are, and you will have to click next. But know that once you've got data in all of your particular pages, you can navigate your application through these particular menu items. But again, to ensure that your items are saved, you'll want to click next. Here's where you will enter your project abstract. So I will just put in some data here, test abstract. Oops, if I could spell. It's still not stract, is it? Stract. Okay, and then you would actually complete your particular project abstract and answer in as much detail as possible for the characters that you have, and then click next to save your data. This is your proposal narrative where you will begin to answer the questions with regard to the actual meat, if you will, of the RFP. You'll want to make sure that you have your actual RFP handy to ensure that you have the proper instruction and direction on how to most effectively answer the questions in this section. So this particular grant, of course, is infant mortality. The demographics is, whomever you are focusing. It can be more than one population. You check as many as you are serving. Your gender for the hub is female, and then whatever age groups that you intend to serve. Then you'll provide a description of your agency. So you will put text here. Then you will have answered the following question. You will put that data there. And again, you'll remember that each of these text boxes will allow you to know how many characters you have. Remember, not words, but characters. How many you have left in each text box. So you'll scroll down through each of these and answer them in completed sentences and in the allowable amount of space. Please know where there may be duplications in the system, because again, it's brand new. There are a couple of questions that are repeated. Please do excuse our dust, if you will. Where there is a duplication, you are welcome to cut and paste your previous answer, or you are welcome to say duplicate question. You will not be dinged for either of those responses. So you will scroll down through this particular page, and then you will hit next because your page will be complete. This section, select your elements of sustainability, is simply asking you how will you maintain your funding or your grant activity should funding from the commission no longer be available. So you click on that box, and there are several different ways that are listed. So you will select as many of these that apply to your hub as possible. You may apply for other funding resources. You may have a local legislator or champion or an agency in your particular area who's going to partner with you, alternative funding, and you would select your particular option. So if you clicked alternative funding, you would then put your description here. I'm just going to put other grant resources. You will answer this question in full, of course, and then click add. And then down here, your element of sustainability will be listed. For the purposes of this sample application, I'm just going to move forward to show you the next screen. This is your staff description. And this is where you will add staff. But prior to adding staff, you need to put in, to answer this question, describe your agency's plan to ensure assigned staff are culturally and linguistically competent. You will answer this question in full in this text box. So now it's time to add your staff. So you click on the Add Staff button. We'll just do anyone's name. We'll do Sharon Sharp. And we are going to say that she is the Chief Executive Officer. Just for test purposes, I'll put my email address in here. You will put whatever this person's email address is, their particular age group. This is my mom's name. I'm going to make her 20 to 24. You will put her ethnicity, gender, and then the composition is where this person is assigned. So if it's an employee, you'll click employee. If she's on the advisory board, the advisory committee, you'll click advisory committee. If she's on your agency's board, you'll click board. In this case, we're entering our staff. I will put employee. Staff qualifications, I will just put her education and experience. You will answer this fully with regards to their education degree or years that they've been in service and so forth. Very brief. Then you scroll down and you click Save. You do the same thing for a board member. So let's go back and look, do an advisory committee, an advisory committee member. We'll just do John Sharp. Oh, hello, spell it correctly. We'll make him the COO. You'll put in their appropriate email, make him the same age group, because this was my dad, make him the same age. We'll do African American, gender. Now composition, we'll make him a part of the advisory committee. And then you'll put staff qualifications. Again, you will answer this fully. I'm just putting in text or test content so you can see how this page works, and then you click Save. So now you see you've begun the list for your advisory committee and your employees. You can also go back and place members of your board. But that's what happens in the staff description section. Very easy. You'll next go to, now remember on this page, once you're done, you are going to click Next to save this data. You'll also note, again, the time is still ticking away up here at the top, but never fear, as long as you're active on these pages, the time will just refresh repeatedly. So next we'll go to staff implementation. You will hit Next. I'm just demonstrating the pages, so I will click Method of Implementation. This is also a really good portion of how you're going to do what it is that you're going to do. So please make sure that you answer these questions in detail. I'm just going to put in a little test text here to show you how many characters are left. So you see you have 3,000 characters for this particular box. I've used 4. So you have 2,996 characters remaining. So you will go through and answer each of these questions in detail. Again, there may be a duplicate question here as well. Also, excuse our dust. We will get that corrected in our next iteration of this application. But you'll answer each of these questions in their entirety, and at the conclusion of these questions, you will hit Next. That will ensure that your information is saved. We are going to move forward and go to the project action plan. Okay, for this particular section, I am going to hit Edit because I've entered some test data. You'll see at the top where you have to define your project model, which you've done. You're in the hub model. You'll define your goals, objectives, your approaches and activities, and then it will allow you to review what you've entered. So for the project model type, you're going to select evidence-based from the drop-down menu. For the project model, of course, you're going to do hub. And then for project model description, that will pre-populate for you. For the type of interest, you can do basic human need. For for your particular selection. You could also select access to health services. Both of those would be accurate. The start date, you would put whatever the start date of your grant is. Our grant year for our purposes is going to be January 1 of the next year. So you want to make sure you put that appropriate date in. The end date is December 31st of next year. So you'll put that information in there. And then you will click next session. But if you can't and you want to save and finish this later, you can click save and finish later. But I will just demonstrate. We'll move on to the next section, forgive me. Okay, here is a little more new system dust, if you will. This is a shared grant system. So the state agency in which we are sharing this system, their applicants only have to select at least one goal. Our applicants must select each of the required goals and objectives. So where you see required, you'll want to make sure that you check each of those boxes. So you see required goal 1, required goal 2, and required goal 3. I left the other previous boxes open because for some of you, you will be familiar with these boxes. Those are the old goals and objectives. Those goals and objectives that were not able to be placed in a numeric standpoint were included in the narrative section, so you've already addressed those. But in this section, you must do required goal 1, required goal 2, and required goal 3. Then you will click on next section. Here you can see our indicator has moved to define objectives. You'll need to check each one of these objectives to ensure that you have gotten all of the required objectives for your required goal number 1. You will be able to see here in this tan line which goal you're addressing. You're addressing goal number 1, required goal number 1. So for required goal number 1, you must select each of the required objectives. And remember, wherever you see this red asterisk, you must respond to that given question. So we will either save and finish later if you have to go and come back, but for our purposes, we'll choose objectives for the next goal. Here, you'll go through and check all the required objectives. Oops. You'll go through and check all of those. So ordering, okay. Then you will click choose objectives for the next goal. There's only 3, so you'll go through and click each of those. And then you'll move on to the next section, forgive me. And here you are further defining your objectives. So also new to this system, you'll want to make sure that you enter the appropriate number served or the appropriate number you intend to serve for a given objective. So this objective reads, in this grant year for the objective listed above, you expect to serve blank out of blank will be met. I know that doesn't read like a regular sentence, but if this given objective where you are seeking to train your hub staff, if you are going to have 5 hub staff, you are going to say 5 out of 5 will be met. If you have 7 hub staff, you're going to want to train them all, so you will have 7 out of 7 to be met. That error that you saw will help you to understand that your numbers don't match. So you'll want to make sure, that your number achieved is not greater than your number served. So that's just a way the system helps you keep track of your goals and objectives. So we'll put 7 back. You're going to choose your level of change. This is individual because you're training 7 staff members. And then you'll place your linkages between the program design and each required goal here. So this is just how this particular objective helps you attain your goal, which helps you reach the overall goal of reducing infant mortality. So you'll just put some of that text here. And then you will supply details for the next objective. So you'll do that for every one of your objectives. And while it doesn't read exactly as you would in a regular sentence, whatever number you seek to serve in this particular objective needs to be placed in those boxes. And then you go on to define your approaches, which is where you're talking about how you're going to do this particular objective, and then activities, specifically what you're going to do, the actual, literally the activity of your objective. And that's how you would complete this section. And once you're done, you're actually able to review it. So let me go back and show you what I mean by that. So we're going to go back to the previous section. And I'm going to show you how you do that. So if you want to review everything you've put in, you will click Review. This shows you what your goal is, what your objective is, and if I had entered all of my approaches and activities, they also would be listed here. This will let you make sure you've addressed each of your goals and objectives that are required, and that you've addressed them appropriately. So you're able to just get a quick overview of specifically what it is you've addressed. If you click the link, it'll take you right to that given area. Okay, so now we'll go back so that we can continue on with the rest of the application. That's your project action plan. You're literally just entering data. Then you'll move on to your line item budget. If you'll notice, there is a warning at the top letting you know that your total of the other amount should be at least 20% of the total commission amount. This is your 20% match. Your other is located over here. So you'll want to make sure that you put what each of the quarterly amounts that you'll need in each of the line item boxes. You'll enter that information here. You must enter narrative for any line item that has an entry, a monetary entry. You must put in narrative. Your other, again, is your match. So this particular spreadsheet will total across, and it will also total going down the page. But you'll want to make sure that your other total here at the bottom is at least 20% of your commission total. Once this page is complete, you would then hit next. And again, for our purposes, we are just going to go to your project documentation. This is where you upload documents into the MHGM system, because you cannot email or drop off or fax or whatever any of your application documents. They have to be uploaded into the system. There are 3 that have been provided for you: the Civil Rights Act, the Rehabilitation Act, and the W-9. You have to download each of those forms. You must then manually sign them, as they say over here in the description, and then upload them into the system in the upload section. So again, you'll have to download each of these forms, sign them, and then save them on your hard drive, and then upload them in the system. And to do that, you will simply find the document that you are seeking to upload. So say it's the Civil Rights Act form. You'll select that type. You'll type in what it is, and this is the Civil Rights Act, of 1964, and then whoever your evaluator is. And then you'll choose the file from your hard drive. Once you've got that selected, you hit Upload Attachment, and your attachment will begin a list for you on this page. You'll do that for each of these 3 documents. Then for further documentation that's required, remember this red asterisk? This is where you'll have to go down the screen to ensure that you've included each of these items. Your 501c3, you'll need your administrative compliance form. Your administrative compliance form will be found on the commission website. You will scroll down the commission website. You'll see a box that says grantees. Within that box, you'll see grantee forms. Click on that box, and you'll be able to see all the forms that are needed for for applications. Your administrative compliance form will be found there on the commission website. Your board resolution you would obtain for yourself, save and upload. Your community care agency contracts, the civil rights form has been provided for you. All these areas that have a red asterisk must be submitted. Your evaluation plan narrative is critical. There is a description in the RFP that details the qualitative and the quantitative requirements of the evaluation plan narrative. Please do have your evaluator, you and your evaluator work together to ensure that this portion of your application matches what you've said you're going to do in the program. So you'll want to make sure that you work together to ensure that evaluation plan is measuring specifically what it is that you'll be implementing for the program, and that the outcomes that are shown in your project action plan are addressed by your evaluation plan. So once all those documents are completed, you will save them and upload them on this page. They must be uploaded into the application to have them referenced for your scoring processes. So you'll be able to scroll down this page to see all the required documentation. And then once all those items are completed and uploaded into the system, you would then go to your signature page. So your executive director, which will register and have access to the application, as will your project director and your fiscal officer. Each person should register themselves and receive login credentials from the system. They would then come in and click I agree with regard to the statement at the top of this page, which is checking the box below is the equivalent of a digital signature. And then it goes on further to say what that means. They click the box. They would also download the signature page, sign it, and then upload it into this project documentation page, as we said earlier. So they would, again, download each of the pages after they have checked the box independently as they've registered in the system on their own, download each of their respective pages, sign them and upload them into the system. You would then hit next. And from that point, you'd go to the submit area. I don't have a submit button because I didn't finish the items on this signature page, but you would then hit submit, and that would constitute your completing the actual hub application. So I will go back to our PowerPoint from our current slide. And that was the application system in review. Again, you'll be able to watch this as many times as often and submit your questions for response as well. So just some system quick tips. Please make sure you pay attention to the system expiration. It's there for actually cybersecurity. And we have got to make sure that we follow those guidelines. There's no way around that. We want all of your documentation as well as the commissions to be protected. So where you see that timer, as long as you're operating in the system, it'll refresh every 5 minutes. If you leave and leave the page unattended, follow the prompts in the pop-up to make sure that you save your documents or the content into on that particular page rather. Remember, finishing the content on one page and clicking the next button is the best way to save your documentation in the application. All fields with a red asterisk must be completed. Character counts, these are just several of the areas that provide you with samples of the character counts. Each of the text boxes will provide you with that information. And then again, with the required reporting and participation requirements, I will not read these to you in verbatim, but please do read these to understand the important aspects of the project that are required once funding is awarded. You'll want to make sure that you have all of that information entered and responded to, and that these are all the things that you'll have to do to remain compliant with the grant. So I will not read these verbatim. You have the opportunity to read through these. Remember that the application due date and time are included in the RFP. So please do consult that RFP for those important details. And if you should have questions regarding the system or the actual hub RFP itself, please do email minhealth@mih.ohio.gov, as you see before you. As staff, we're only able to answer questions in writing during an open round of funding. And we want to make those questions available to everyone. So those questions, once responded, we'll send your response to you from the MinHealth email address. And then we will begin to gather a frequently asked question document and post that to the website under the Hub RFP section. So that concludes our presentation for today. We thank you very much for tuning in. If you have any questions, again, post those questions to MinHealth. We'll put this link on the website so that you're able to access this pre-recorded session at your leisure. We wish you well, and we look forward to receiving your application. Take care, and thank you very much.